I'd like to introduce Mary from the US, who takes LDN for Lyme's disease. Thank you for joining me, Mary.
Thank you, Linda.
Could you tell us when you first started to get sick? How long ago was it?
It was approximately 4 years ago. I had an unusual occurrence. I was 42 years old, and I was in great shape. I was working out 4 times a week, but I suddenly had a heart attack.
Goodness.
And it was very shocking. I knew immediately that it was a heart attack. It was a very mild heart attack. I was hospitalized, went to the emergency room, got hospitalized. They saw that my troponin had gone up and my CPK levels had gone up, which are indicators of muscle damage. Specifically, the troponin is heart muscle damage. So they had elevated it, and it indicated that I did have a heart attack. 3 days later, I had a cardiac catheterization which showed no coronary artery disease. So that was a little strange at the time. After that, I started having body pain, a lot of body pain, exercise intolerance, a lot of fatigue. Went to my doctor, my primary care, and he suggested that I had fibromyalgia, and so started me with Cymbalta for the nerve and muscle pain that I was having, which at that time, compared to what I've had the past few months, was mild. So it went on like that. I wasn't really satisfied with the fibromyalgia diagnosis, so I started researching things myself and kind of pushing my primary care, what else could this be, because you didn't really rule out any other kind of disease process that was similar to the symptoms I was having, or that fibromyalgia sufferers experience. He kept insisting fibromyalgia, so I left it. 2 years after that, approximately, I started having worse symptoms. I started getting worse, where it started interfering with my life. So this is 2 years out from the heart attack and approximately 2 years out from where we are currently now, time-wise. So the symptoms started getting worse. I started seeking out specialists, neurologists, arthritis, ortho, spine specialists, had several tests, stress tests for my heart because of the fatigue, started developing palpitations, transient tachycardia, neurological symptoms. My fingers and toes were tingling numb. The bottoms of my feet were burning. The fatigue was terrible. Every day after work, I would hit the bed 2 hours, slept hard, real hard, long naps. All the tests, all the specialists I went to indicated nothing was wrong. I had sleep studies done. I had EMG studies done for neuropathic symptoms. Blood test after blood test was coming back normal. The only things that were coming back abnormal were my inflammatory markers. My SED rate was a little elevated. My CRP, my C-reactive protein, was way up there, like 21. So it was at this time, approximately a year ago, I work in an operating room and I'm a nurse. And so I've had discussions in the past with a doctor that I work with in the operating room. He's a urologist. And he practices mainstream medicine, but he also takes a holistic approach, initiated by his son's autism, looking for other options to treat it. So we would talk every once in a while about what he was doing with his son and the symptoms I was having. So I spoke to him about a year ago about how bad the symptoms I was having, and that a lot of the research that I was doing personally the majority of my symptoms matched several autoimmune disorders, MS, Sjögren's, fibromyalgia, lupus, chronic fatigue, Epstein-Barr. I was coming up with all these different disease processes that seemed to have the same thing in common, autoimmune. So in talking with my friend at work, the urologist, he mentioned LDN. He said that he had been using it for his son and actually was himself on it preventatively and had his children and his wife using it also preventatively because it boosts the immune system is what he told me and was beneficial for, even in some cases, from what he told me, helping the immune system fight off certain cancers. So I did a lot of research on it. He wrote out a script for me. I started taking it, and I hate to say this, it could be placebo, but within a week or two, I started experiencing my fatigue level was diminished. I wasn't as tired as I was at the end of the day after work. My body pain, I noticed, had somewhat was better. Joint and muscle pain was a lot better. At that time, I had also started modifying my diet: no gluten, no dairy, much less sugar, eating cleaner, organic, free-range meats, things like that. So I've done a lot of things to try to mitigate the symptoms that I'm having. You know, I'm trying to stack the deck in my favor as much as possible. And I found with the LDN and the diet that in the 3 months since I started taking the LDN, I think I'm into the end of my 3rd month, I actually am able to keep working, which I was really afraid because one of the things that was initiating this big push to, you know, what was causing my problems was my symptoms were getting worse and worse. And I actually feared that at the progression of the deterioration that I was experiencing, that in a year, maybe less, I wouldn't be able to work anymore. I was having trouble walking. I had terrible hip pain, terrible joint pain, and the fatigue was just unbelievable. What they call brain fog, cognitively being able to keep up with what I needed to do at work to function and keep my patients safe and assist my team in the operating room. It was all, you know, slowly going downhill. But the LDN has helped me with all of that, I've noticed. I started at 0.5, and now 3 months later I'm at 3 milligrams. I initially tried to go to 4.5, but it was a little too much. I was experiencing some anxiety and some insomnia. So we backed it down to 3, and that's where I've been for about, I'd say, 6 weeks. And so the only thing that I can say about LDN personally that has been troublesome is taking it at night. They suggest you take it at night a couple of hours before you actually think you're going to fall asleep. I started taking morning dosages because it was keeping me up a little bit. I was experiencing some insomnia. So I've started taking morning doses, and I haven't noticed any problems with that. But I've talked to workmates, I've talked to friends who have autoimmune, like fibromyalgia. Anybody that will listen, I will talk to about LDN, because I really think from my own personal research, reading, and I've joined forums on Facebook and listened to other people's testimonies and how it's helping them. I really do believe this is something that can benefit a wide array of disease processes. And I have recently clinically been diagnosed with Lyme. All the blood tests have come out negative, but they do believe it's some form of chronic Lyme that I have. And so I started a 6-week course of antibiotics, but I really don't think I want to pursue antibiotics. I want to try to go in a more, I'm going to say natural way. And I even though LDN is a medication, I really do feel like for the amount of, for the degree of benefits that I'm experiencing, as opposed to the side effects, it's not like a mainstream medication. The Cymbalta that I used for what the doctors thought was fibromyalgia that I had, the side effects of that are just sometimes as bad as what you're experiencing from the disease process. But the LDN really has enhanced my life, I believe, I feel personally, and has benefited me. It's actually given me, even mentally, it's helped me feel like, you know, the benefits that I'm getting from it, I'm actually feeling like, okay, I can keep going. I can keep my job. I can keep my career, which is important to me. I can keep my lifestyle. And I still have to do things like be careful about my activity and my diet. But I really feel like if I hadn't come across the LDN, if my friend at work hadn't suggested it to me and I hadn't started it, that I wouldn't be having the progress I'm having now. I'd actually be in a worse state. So I'm really grateful for my friends for suggesting it, and I advocate it myself to anybody who will be open-minded enough. I'm surrounded by medical professionals who know what Naltrexone is, because we use it in the operating room as in the form of Narcan to reverse narcotic effects at the end of surgery for people who may be too respiratory impaired from the narcotics to wake up. Mm-hmm. And they've never heard of LDN, the low-dose naltrexone, and the benefits it can have just taking it for any different kind of condition you have. And even as, you know, my doctor who takes it preventatively, I think is an awesome idea. So, but again, I really didn't hold out much hope because mainstream medication is its effects are so profound. Every specialist I went to either wanted to raise the level of Cymbalta I was on or put me on gabapentin, Lyrica, medications that are very powerful. And if you look at some of the side effects of these medications, they in themselves affect the immune system. The SSRIs, the gabapentins, the Lyricas, they actually hit the immune system. They cause sores in the mouth. They cause fevers and flu-like symptoms. So I feel like they actually may, in somehow, I don't know, damage the immune system or the body's ability to fight disease. That's why I was so happy to come across LDN. And again, so grateful. Because it's
just an absolutely amazing story. For people that have got Lyme, it is very inspirational, because a lot of people with Lyme, as you know, find it very difficult to get diagnosed, and it's not all in the mind. You know, it is a real condition.
No.
And I mean, you're proof, you know, how well LDN can work. It's amazing.
Yep, I really do. I'll do any, you know, I'm at the point where, again, my friend is going to start it. She has fibromyalgia. Her husband has also chronic Lyme. So they're going to go see this doc that I'm speaking of to start it. I'd like my husband to start it. He has he's diabetic, which is autoimmune. And the plan is to start him shortly on it. So
maybe we can interview you again next year this time and do a follow-up.
Say again?
Next year this time, perhaps I can interview you again for a follow-up.
That'd be lovely.
Yep. Okay. Well, thank you very much, Mary.
Thank you, Linda.